Hey, I'm Alan Stevenson, the founder of the Multiple Myeloma Warrior community, and a lot of you know that I'm also the chief patient advisor for a startup healthcare technology company called Polygon Health, and we created the Patient Connect platform with Polygon, and I think a lot of you are already familiar with that. You've seen our map where you can find treatment locations, you can find other patients, other caregivers, and just connect with the community. And also we have what we call Knowledge Connect in the resources section, where you can go there. There's some frequently asked questions about multiple myeloma. There are, I think 8 to 10, 15 questions about different categories. So one category is the disease, one category is the treatments. So you see these commonly asked questions about these different topics. There's also one about financial resources. So one question that comes up as an example is, can I qualify for Social Security disability if I have multiple myeloma? Because a lot of you are unable to work. And not only will it tell you, it's all AI powered, and not only will it tell you the answer to your question, it'll tell about the Social Security disability, it'll tell you how to apply and other things that you need to understand about that process. And with each topic that in that frequently asked questions section, you can dive as deep as you want to, and it explains things in a very easy to understand way. So it's a tremendous tool that a lot of people aren't using. And we launched that in around August of 24. We just started working on it in January of February of 24. So it's become, it's actually been an amazing progress. And this technology platform can and will be used for multiple diseases. Any disease, any medical condition, this technology platform can work for it. We've actually already built a version for bladder cancer. We'll soon be launching one for myositis due to some personal connections. And so I thought you needed to know about that. Here's one reason it applies to our community is that our community has been involved with technology and that I believe will change lives. It's going to change how we connect with each other. It's going to change how we connect to resources, even financial resources and knowledge. It's going to change how we connect to even the nonprofits in some ways and make it a lot easier. And we are actually in negotiations with some nonprofits to work with them, including some with multiple myeloma. And it's so much bigger than I can even explain. And we believe that this platform can revolutionize not only the communications and connections, but how researchers connect with patients. And I've been saying that we were going to have an app coming out, and there were some things that came out. We actually ended up doing a bladder cancer project for one of the pharma companies, and on some research that they're doing. And so that's why we built that one. But looking at the app and what all was going to take, and I mean, this is a pretty small team with Polygon, and they came up with a much better solution. And I saw a demonstration of it this week, an AI agent, and what it can do for our community and for all patients in any community is absolutely astounding. And I am just thrilled about it. I cannot wait until we launch it. And we're building features into it right now. The Polygon team has been absolutely amazing. I will also tell you, and I'm not going to get into a political discussion, I'm going to tell you that there is a bipartisan effort right now in Washington, D.C. to improve health healthcare technology. Why is it that every time we walk into a doctor's office, a different doctor's office, we've got to fill out something on a clipboard, we got to tell them what medications we've got? Why do we have to tell them what surgeries we've had and what cancers we've had and heart conditions and all this? Why is that? There are other countries where a person has that information, has an app on their phone, they walk in, the app is scanned, and immediately that doctor's office knows everything about them. And right now, currently, the administration that we have, and it's like I said, it's bipartisan, so don't go on some big political rant here, okay? Because I know more about this than you do, more than likely. To solve that problem, to make it more efficient, and put that control. This isn't about the government having access to your records. This is about you having access to your records as a patient. And it makes it easier for you to participate in clinical trials or whatever, and there's so much more happening with that. I will tell you that Polygon recently attended multiple events in Washington, D.C., and Polygon, along with 59 other companies, so there's 60 companies that are considered to be early adopters working for the Centers of Medicare and Medicaid, solving this problem. They have all signed a commitment to work with each other, which is the first time that's happened. And like I said, this bipartisan push. So and you can go to the Centers for Medicare and Medicaid Services website. They call it CMS. I think it's cms.gov. Can't remember for sure. And you go into the area where they're talking about their new technology initiatives, and you will see a tab that says early adopters. You click on that and you can see every company that has agreed to work together to solve these problems. Polygon is one of them. And I'm talking about companies like Google, Apple, Citizen Health, United Healthcare. So this is technology companies, it's healthcare companies, so many more. I'm just drawing a blank right now. OpenAI, Google AI, the list just goes on and on of companies that have agreed to work together, and Polygon is on that list, and I'm their chief patient advisor, which I find kind of hilarious. But I tell y'all all the time, I'm a great idea guy. So this platform was actually my idea, and the Polygon team has taken it and just made it something so much more than what I ever imagined it could be. Each of you that have been on that platform can know that you're going to change lives, and that is incredibly exciting. We're going to save lives, and we're going to put healthcare back into the hands of the patient. And there is so much more coming that is exciting. I hope each of you will participate in the Patient Connect platform, and I'll put the link in the comments on this video. And please consider joining it. What you see there now is just scratching the surface of what it's going to be. And it's going to happen very soon. I've already seen the demonstration, and we're working on it right now. So please consider doing that, and just save the link to it on your browser for right now. Very soon we will have this AI agent launched, and it's going to be so much better than the app that we originally were talking about doing, and you're going to love it. So imagine having your own healthcare assistant right there in your pocket. So that's what we're talking about. Talk to you later. Bye-bye.